Hello, everyone. My name is Shonda Banks. I will be doing role A for neurocognitive disorder due to traumatic brain injury. Neurocognitive disorder due to traumatic brain injury occurs after an impact to the head. Mechanisms of rapid movement or displacement of the brain with the skull. Traumatic brain injury, TBI, will present immediately after injury to the brain or immediately after consciousness is recovered and persists past the acute post-injury period. The DSM criteria for TBI includes loss of consciousness, post-traumatic amnesia, disorientation, confusion, neurological signs such as neuroimaging demonstrating injury, new onset of seizures or worsening of pre-existing seizures, visual field cuts. Over a million traumatic brain injuries result in emergency room visits each year in the United States, and over half of those injuries are male. 2% of the population live with traumatic brain injuries related disabilities. The most common of these injuries are due to automobile accidents, falls, and being struck on the head. Contact sports are being more recognized as sources of mild TBI. Diagnostic features include, which this is the criteria for the DMS, includes loss of consciousness, post-traumatic amnesia, disorientation and confusion, and neurological signs, which could include neuroimaging demonstrating worsening of pre-existing seizures disorder, visual field cuts, on new onsets of seizures as well. Associated features, according to the DSM, include disturbance in emotional function, which could include things like irritability, easily to be frustrated, tension and anxiety, and then also personality changes include things such as empathy, suspiciousness, and aggression. And then for physical disturbance, the symptoms include headache, fatigue, sleep disorders, vertigo or dizziness, tendinitis, photosensitivity, insomnia, reduced tolerance to psychotropic medications. And then neurological symptoms occur, can include, and this is more associated with more severe traumatic brain injury. So some of the neurological symptoms can include seizures, visual disturbance, cranial nerve deficits, and evidence of orthopedic injuries. According to the DSM, there are different severity ratings for traumatic brain injuries that are include mild traumatic brain injury, moderate traumatic brain injury, and severe traumatic brain injury. And severity is rated at the time of injury, initial assessments as mild, moderate, or severe. The severity rating of the traumatic brain injury itself does not necessarily have to correspond with the severity of the neurocognitive disorder. The course of recovery from traumatic brain injury it varies depending not only on the specifics of the injury, but also on cofactors, age, prior history of brain injury, or their history with substance abuse. All those can depend on their recovery time and not recovery. Okay, development and course. There is a wide range of neural symptoms associated with traumatic brain injury. Neurobehavioral symptoms can tend to be the most severe in the immediate aftermath of having a traumatic brain injury, except in the case of severe traumatic brain injury. The typical course is that of complete or substantial improvement in associated neurocognitive, neurological, and psychiatric symptoms and signs. Neurocognitive symptoms associated with traumatic brain injury tend to go away within days to weeks after the injury, usually with complete resolution, typically by 3 months. Neurological symptoms includes things such as depression, irritability, fatigue, headache, photosensitivity, sleep disturbance, which tend to resolve in the weeks following a mild traumatic brain injury. But with repeated mild traumatic brain injury, may be associated with pre-existing neurocognitive disturbance as well. Neurophysiological, emotional, and behavioral complications can be associated with moderate and severe traumatic brain injuries. These things can be in addition to pre-existence of neurocognitive deficits, which include seizures. This is particularly within the first year. Photosensitivity, irritability, aggression, depression, sleep disturbance, fatigue, apathy, inability to resume occupational and social functioning at pre-injury level, and and it also interferes with their interpersonal relationships as well. For moderate and mild traumatic brain injuries, there has been a increased risk factors for things such as depression, aggression, and also possible neurodegenerative disease such as Alzheimer's has also been associated with moderate to severe traumatic brain injuries. Age, specifics of the injury, and cofactors all play a role in features of pre-existing neurocognitive disorder due to traumatic brain injury. So, for instance, pre-existing traumatic brain injury related impairment in infants or children may reflect their developmental stages or milestones, such as you'll notice that in their language, also in academic performance, and possible impairment with their social development as well. Among older teenagers and adults, pre-existing symptoms may include various neurocognitive deficits, such as irritability, hypersensitivity to light and sound, easily fatigue, and mood changes, including depression, anxiety, hostility. Those are some of the things that you'll find in older teenagers and adults. With older adults, individuals with depleted cognitive reserve, mild traumatic brain injury is more likely to result in incomplete recoveries. Some of the risk factors for traumatic brain injuries include falls, automobile accidents, and being struck on the head. The rate of traumatic brain injury varies by age, with the highest prevalence among individuals younger than 4 years old, older adolescents, and individuals older than 65. Falls are the most common Causes for traumatic brain injuries, with car accidents being the second most common. Sports concussions are frequent causes for traumatic brain injuries, and they're getting a little bit more attention drawn to that. Um, Traumatic brain injury in older children, teenagers, and younger adults is usually associated with more with the sports concussions. Um, Diagnostic markers would include neuropsychological testing, CT scanning, and magnetic resonance imaging, which that will reveal hypersensitivity, uh, hypersensitivity in microhemorrhaging as well. While doing this assignment, this whole issue reminded me of a movie I saw that starred Will Smith. It's called Concussion, and this movie is kind of centered around this traumatic brain injury and sports concussions, and particularly with football players. Um, I hope you guys enjoyed my video. The next slide. This will include my this includes my video link to for more information related to neurocognitive disorder due to traumatic brain injury. Thank you and goodbye.